Okay, for my students at Sissonville High School, I'm getting my camera ready again. This is part 2 of the video lecture here on treatment. So we just got through talking about psychodynamic therapy and psychoanalysis. Now we're going to move into a different type of therapy, client-centered therapy. Client-centered therapy focuses a lot on empathy, and I have the little image there on the left. I thought that was kind of neat. E, everybody needs somebody. M, model and mirror. P, put yourself in their shoes. A, ask if you can help. T, treat others the way you want to be treated. H, hurtful or helpful. Y, you feel better and they feel better. So client-centered therapy is all about empathy. We're moving away from this whole idea of unconscious forces that are causing problems to something different. Client-centered therapy, write this down, okay, is a type of therapy that focuses on people's potential for growth and the importance of an empathic therapist. So we're back to the word empathy again. So the hallmark feature of this type of therapy is empathy. If I am a client-centered therapist, then I have to feel empathic. I have to have empathy for my clients. And the two cartoons I think here on the right kind of capture that. The woman up here in the chair, I hope you guys can read these, but I'll read them to you just in case, is saying to the cat, how would you like it if the mouse did that to you? And the cat obviously has the dead mouse at his feet. Then you have the two people here, I know exactly how you feel, because they both have arrows in their backside. So, empathy. Carl Rogers, that's an image of him, is the psychologist who is most associated with client-centered therapy. Client-centered therapy arose from the works of this psychologist. And this is a quote from him. A creative, active, sensitive, accurate, empathic, non-judgmental listening is for me terribly important in a relationship. That sounds like pretty good stuff, doesn't it? It is important for me to provide it. It has been extremely important, especially at certain times in my life, to receive it. Some terms associated with client-centered therapy: incongruence. According to client-centered therapy, this refers to a mismatch between a person's real self and his or her ideal self. A lot of times we like to think we're a certain way, but when it comes right down to it, maybe we're really not quite that way. I like to think that I'm honest. I like to think that I have patience. I like to think that I can speak pretty well. There have certainly been times where I have been very impatient. There have been times where I have not told the truth, and there have been times where I have not articulated very well for various reasons. So sometimes there's a mismatch between the person's real and ideal self. And I think this cartoon kind of captures it. The man is standing up, pounding on the table with a terrible look on his face. He looks angry, saying, "Of course I love you." Well, he's saying that, but he's not acting that way, as you can kind of see that. Another component of client-centered therapy is something called unconditional positive regard. Unconditional positive regard. A therapist working under this type of therapy must also provide this. They must convey positive feelings. Write this down. This means that the therapist must convey positive feelings for the client, regardless of the client's thoughts, feelings, or actions. Now, you don't have to be a client-centered therapist to have unconditional positive regard for people, necessarily. I've worked in a prison system for many years. I've done therapy with countless inmates who have done a lot of terrible things, rape, murder, stealing from people, horrible cases of domestic violence perpetration. And it's, according to this therapy, if you're doing this kind of therapy, you still have to understand and realize that this person has worth to society. And I would still have to convey positive feelings, regardless of what this guy or girl has done in the past. And that can be pretty tough for some people to do, especially if you're dealing with someone who's a sex offender or a child sex offender. I've done therapy with some people who've done some pretty awful things to children, and it's hard to not pass judgment sometimes. But you see the cartoon up here as I'm pointing to. I hope you can read that. It looks like a children's sketch saying, "You are awesome." And then down here you have the mother and the daughter saying that when you're a parent, you love their kids no matter what they do. That's unconditional positive love. Okay, the next type of therapy that I want to talk about is cognitive behavior therapy. So we're getting into a different type of therapy now. We're moving away from the idea of unconditional positive regard and empathy, and we're moving into a type of therapy, you want to write this down, a type of therapy that's designed to help patients both reduce problematic behaviors and irrational, unhealthy thoughts, and to develop new, more adaptive or positive behaviors and beliefs. Okay, that's cognitive behavioral therapy. And I have a few images on here. With the cognitive behavioral sequence, you have the events. This is the stuff that happens in your life. Things happen to all of us. There's like 10 of you in my class, myself counts 11. So if we're all sitting in class, we could all experience the same situation. As maybe someone walks into the room and says something that could be deemed offensive. Maybe someone comes in and starts cussing, dropping F-bombs, and then they leave our room. God forbid. Some of us might be like, whatever, that was weird, but okay, whatever. Others may find it deeply offensive and would internalize that more. So how you think about that, your senses input into the brain, how you store it, how you remember it, how you experience it is going to decide your response. Some of you may not respond to that at all. You'd be like, okay, that was dumb, whatever. Some of you may find it funny. You may laugh at it. Others may be, again, very offended, and you may run to the office and report this person. So your behavior can be impacted by your thinking in terms of how you interpret the events that happen. Sometimes we internalize things and we think about things that happen right here in very maladaptive ways that causes problematic behaviors that creates problems, mental health problems for us. I'm not going to go over all this again, I promise, because I know I did it before, but when we talked about the different models of learning, we talked about classical conditioning and instrumental conditioning. You remember, with classical conditioning, you had the unlearned stimulus, the unlearned response, the conditioned stimulus, and the conditioned response. I'm not going to hit you with that again. With instrumental conditioning, we talked about reinforcement and punishment. I might talk about that a little bit more here in just a few minutes. But these are some terms associated. We'll talk about a few of these. So, behavior therapy. We're now moving away from the idea of cognitive behavior. Cognitive behavioral therapies combine the thinking and the behavior. Behavioral therapies now are focusing more on the observable, measurable behaviors. So here's your definition for behavior therapy. This is a type of therapy that's based on well-researched learning that focuses on modifying observable, measurable behaviors. Okay. Again, a type of therapy based on well-researched learning principles that focuses on modifying observable, measurable behaviors. So we're trying to change or modify behaviors that are negative. And there are different ways that we can do that. Here are some components of behavior therapy. Eek, spiders. Exposure. Exposure, you want to write this down, is a therapeutic technique where repeated encounters with a stimulus, let me back that up. Exposure, is a therapeutic technique where through repeated encounters with something, like a spider, or needles, or heights, or whatever, I've got spiders in this example, a person will become less responsive to that stimulus. In other words, it's like desensitization. The more you're exposed to something, the less it affects you. We talked about desensitization early in the semester. The example that I always use is the very first scary movie you ever watched. If you can think about when you were a kid, young, the very first scary or gory movie that you watched, it probably messed with you a little bit. Now that you're 16, 17, 18 years old, you've probably seen movies like that a million times, and they probably don't affect you that much anymore because you've been exposed to it so much, it just doesn't bother you. Well, the same premise here. With exposure, if someone is afraid of spiders, like the woman here on the left, who is obviously not having a good day, that initial exposure is going to be traumatic. In theory, if I expose her more and more and more to spiders, she's going to get to the point where it's just not going to bother her as much, or maybe not at all. Some other components of behavior therapy include systematic desensitization, and we'll talk about what that means. That involves a couple of things: progressive muscle relaxation and contact with the feared stimulus. Now, systematic desensitization, and you'll want to jot this down. This is a behavioral therapy technique, because we're talking about behavioral therapy here, where people are taught to be relaxed in the presence of a feared object or a feared situation. Okay? Again, people are taught to be relaxed in the presence of a feared object or situation. And I've got this diagram here, relaxation routine. A lot of times, you'll have the client sit in a chair, scrunch up their face, and then relax it. Tense up their arms and then relax it. Clench their fists, then relax it. So you're getting to the point where you're tensing and you're relaxing. And then you have the actual contact with the feared stimulus, whether it's spiders, might be needles, might be whatever. And the idea is that you practice staying calm. Now, with systematic desensitization, generally the person is exposed to that feared stimulus slowly or a little bit at a time. So if the person with systematic desensitization, if we're trying to get someone to not be afraid of spiders, then I might pull this woman into my office. I might show her a fake spider, and I may make her look at it at a distance of maybe 10 feet for 10 seconds. And then once she's okay with that, then we're going to get it closer to her. And then maybe she's going to have to look at it at a distance of 5 feet for 20 seconds. Okay, now that she's okay with that, now I'm actually going to put the fake spider in her hand, and she's going to have to hold it in her hand for 10 seconds. And slowly, systematically, you're introducing the stimulus to her to where it's always around her. Maybe you get to the point where you put a real spider on the table in front of her. I'm not recommending that, but that you could do it that way. And it gets to the point where that fear just becomes extinct. I mean, it's desensitized. And it can be very effective. I'm going to go ahead and call that the end of this part. Thank you.